The views and opinions expressed by guests on this podcast do not represent or reflect the official policy or position of the Take a Paycheck Foundation and podcast. All information shared is from personal experiences and does not constitute medical advice. We do not take responsibility for any statements expressed during the podcast. Take a Paycheck does not endorse any products or services. Any said products or services mentioned on this podcast may not be suitable for you or your condition. Please consult with your physician if you have medical questions, as it may pertain to your condition.
Hey everyone, welcome back to this week's episode on Take a Paycheck. I'm so excited to have Cassidy joining me today. Hi Cassidy, can you give me a brief introduction about yourself? Tell me a little bit about your education, your hobbies, and your future plans.
Sure. Yeah. Thanks for having me, Natasha. I'm really excited to be here. So in terms of education, I'm a first-year medical student at Dalhousie University right now. And outside of medical school, which is pretty busy, I also like to do art, camping, thrifting. I'm a patient partner, and I'm hoping to be a pediatrician after medical school, maybe specializing in rheumatology. I think it's pretty cool, but we'll have to wait and see and figure out what my interests are.
So you were on this podcast because you're diagnosed with a rheumatic disease. What is your condition?
Yeah, so I have fibromyalgia. I also have POTS as well, but in terms of rheumatic, it's fibromyalgia.
And when were you diagnosed with fibromyalgia?
So I was technically diagnosed, I think in like 2020, but had experienced the symptoms of fibromyalgia since I was about 14, because I had central sensitization chronic pain, which is the mechanism behind fibromyalgia. It just didn't affect enough of my body to be diagnosed as fibromyalgia until 2020.
So can you guide me through the beginning of your symptoms? I know we talked a little bit about just like the chronic pain, but how did that kind of lead you to actually see a healthcare professional?
Yeah, so it started out with some pain and like snapping in my hips while I was training as a high-level speed skater. And so I kind of just thought it was like a soft tissue kind of like injury, overuse kind of that you can get when you're training at a high level. So I kind of looked into that, went to physio, saw a doctor, bounced around to a bunch of different specialists for like a year. And they all kind of had an idea of what it might be. And then they kind of figured out that it wasn't. And so eventually I got some MRIs and some x-rays and saw an orthopedic surgeon. And at this point I was in like significant pain, was not really able to skate anymore, was struggling to keep up with school and stuff because I was in so much pain. And so he said that I had some like cartilage tears and a bone kind of difference in my hips, which was probably causing my pain. And because of my speed skating, he said he had like never seen a 15-year-old with so much damage in their hips. So that was kind of what they attributed my pain to at that point.
And so what did they do about that hip pain?
Yeah, so I had to stop skating, which was tough because it was like my favorite thing, but with plans to go back. And so the plan was that I would have to have 2 surgeries. And so at this point, it was like the springtime, and I got on the wait list for the surgeries. And then I had to stop going to school because I was in too much pain to go to school. Even like with crutches, I couldn't really walk very far because of the pain. So I finished up grade 10 from home. And then I had my surgeries in the summer. So that was kind of the treatment for that, with a lot of physio as well.
And that's really hard. You know, you were leaving school. What did your peers think? How did you tell them that, you know, you had this new condition of fibromyalgia?
At this point, we didn't really have the name fibromyalgia for it yet. We were still figuring it out. And so I kind of just explained it like an injury. And it was definitely isolating because there's not many people when you're 14, 15 who have to stop school for an illness or pain. So it was pretty isolating, but my peers were pretty like accepting at this point. Although I did like lose some friend groups, and it was very challenging socially.
And that definitely impacted you mentally as well. Would you be able to explain, you know, how did you navigate this life with chronic pain?
Yeah, so it was really challenging for sure. It took a toll on my mental health to have to like stop this sport, which I was kind of wrapping my identity around. And then when I eventually was able to go back to it for a little bit, it was causing so much pain. I was really weak. I had lost a lot of muscle. So that caused a lot of like sadness, grief, kind of stress, anxiety. And my mental health really did deteriorate at this point. So I was kind of dealing with deteriorating mental health and physical health at this point.
So when did you actually get the diagnosis of fibromyalgia? Because you had these surgeries, but it wasn't really diagnosed.
Yeah, exactly. So, yeah, after the surgeries, I started to get better. Like things were going okay. I was able to go back to skating for a bit and went to the Canada Games, but was like in a lot of pain and really struggling there. And then after that, I didn't really get any better. So I was still in a lot of pain and was deteriorating. So weren't sure what was happening, got more imaging, and I got referred to like another orthopedic surgeon at the IWK, the Children's Hospital, and then he referred me to the IWK Chronic Pain Clinic. And this is where they kind of actually figured out what was going on. And they diagnosed me with central sensitization chronic pain, which is basically the mechanism that's behind fibromyalgia as well. But at this point, my pain was only in my lower body. And for fibromyalgia, it's supposed to be like in your upper body and lower body. So they diagnosed me with this central sensitization syndrome, I think it's called. So yeah, there was central sensitization, and then it worsened and spread to the rest of my body. And so at that point, this was when I was in adult care at this point, they diagnosed fibromyalgia because it had spread to my whole body.
So did you transition care from pediatrics to adult care?
Yes. Yeah. So that was kind of rough. I didn't have a great transition. So my IWK team was amazing. They worked really interdisciplinary. There was psychologist, physio, doctor who would all see you together. You'd have like hour-long appointments. And so I was seen there until I was 18. And then at that point, I was too old, so had to transition to adult care. And at this point, I was kind of going through a weird like identity issue with my illness. Like I just was like, no, I don't want this. Like I don't have this. Everything's fine. So I actually didn't go to my first adult appointment, which was not great. Really wouldn't recommend it because then you get taken off of the registry or whatever, and you have to be re-referred. So then I spent like probably a year without any care team, and at that point when my pain started to really worsen and spread. And so then I had to kind of go see my family doctor. She re-referred me to the adult clinic. Luckily, they got me in really fast because they kind of knew what had happened. And so then at this point, finally got into the adult pain clinic, and I'm being followed there now.
So do you see a rheumatologist or another specialist for your fibromyalgia?
Yeah, so that's a good question. So I have never seen a rheumatologist, but a rheumatologist would like usually see a lot of cases with fibromyalgia. I think that people with fibromyalgia are kind of split between chronic pain clinics and rheumatologists. And it's just kind of the way that my journey went, where I didn't present with like swollen joints or something. It was mostly like pain that they referred me right to the chronic pain clinic.
That's really interesting that, for certain conditions, it's not the same specialist. And I feel like that may happen for a lot of conditions too. Like you see either multiple specialists, but for fibromyalgia, it's interesting to know, like I had no idea that it's kind of split between chronic pain specialists or rheumatologists. And you kind of mentioned also like it's obviously impacting your nervous system as well.
Yeah, exactly. So it kind of like presents similar to like arthritis, for example, but it just like kind of the physiology behind it is different.
So how did your parents and your family, like, do you have any siblings? Like, how did they react to you getting this new diagnosis?
Yeah, it was definitely like a whole family affair, especially when we were still trying to figure it all out and I was deteriorating. I know my mom made so many phone calls to try to get me like sped up on the MRI wait list, and she was calling people like every day to try to get me in sooner and advocate for the care that I needed. And so that took a toll on my parents as well, to see like their kid getting really unwell and in a lot of pain and not really sure what was going on. And then I have two brothers as well, and I'm not really sure how it impacted them, but they definitely like do have memories of me being really unwell. Like we had to move my bed into the living room at one point because I couldn't walk up the stairs. So there was definitely some weird little things that wouldn't be typical for a sibling to witness.
Are you from Halifax?
Yeah, I am. So I've been here for most of my life.
Okay, so you haven't had any like drastic changes of environment in terms of like moving out or anything? Where did you go for undergrad?
Yeah, so I went to undergrad at Dal as well, and that was really nice to be able to. I stayed at home for a few years, and that's when I got the fibromyalgia diagnosis. And so it was helpful to have my parents to be able to like help take me to appointments, even throughout undergrad to have that kind of family support was really nice. And it was also nice because then I could continue seeing the doctors that I had seen like as a kid in the pain clinic.
Yeah, that makes a lot of sense because like for me, I moved to Ottawa from Toronto, so it's like definitely more challenging in terms of now I need to find a new doctor, even though I ended up finding like my adult rheumatologist in my hometown city, so I just go there when I need to see her. But I know a lot of people, they have challenges when they move out because not only do you have to like navigate this new school life, basically your chronic illness alone, because for most of your life, your parents were supporting you, being able to get your refills, prescriptions. I mean, my parents still do, but I know that's not the case for like a lot of people that live with a chronic illness and move out. So it's great that you were able to have that support like all the time.
Yeah, definitely, because it's very like life changing to get a chronic illness diagnosis at a young age. So it's definitely important to lean on your support. So I was lucky to have that.
And so you had a hip surgery. Can you tell me a little bit about how you recovered from the hip surgeries?
Yeah, so that was kind of like the beginning of the end, I guess. So I had the surgeries, started getting better, but was like still in a lot of pain. I was going to physio like multiple times a week, and it took like several months to like regain some strength and try to figure out what was going on. And then it was, yeah, I eventually got off crutches, was able to start skating a little bit, and then after this skating like at the Canada Games, kind of that's when things got really worse and then eventually spread to the rest of my body.
And you had to leave a sport that you really enjoyed. And that must have been very hard for you. And we talked a little bit about this at the beginning of the episode and how you had to leave what you were very passionate about. Did you ever end up going back to it?
Yeah, so after my surgeries, I was able to go back for a little bit. But then once I just kind of continued to get worse, I eventually had to stop skating for good. I just wasn't able to do it at all without like really significant pain. And then I was also getting other symptoms of fibromyalgia at that point, like temperature sensitivity. So I can get like in the cold, there's a thing that I can get called allodynia, which means that non-painful stimuli, so like just like touching for example, can really, really hurt. Um, I describe it as like kind of feeling like liquid nitrogen, which is like what the doctor like burns sports and stuff with you. It just like is a really burning sensation. And so I was starting to get some temperature sensitivity as well, which is not great for skating because it's taking place in really cold environments. So it just was really not conducive to being well. So that was really challenging because I had been skating at this high level and I kind of wrapped my whole identity around it. So when I had to stop because of things out of my control, that was really challenging. And I didn't really know who I was without it. I didn't know what I liked. And it was just, yeah, it was a really hard time. And I think people can often minimize like when kids have to stop doing sports, but it can be a big deal because like hobbies are important as a kid and often you wrap up your identity in it. They're source of like mental wellness. So when it's not you deciding to quit, when it's your body deciding that it can't do it anymore, that's really hard.
Yeah, and I totally relate to that. I used to play tennis, and when I was diagnosed with arthritis, I had to quit because I physically could not lift up the tennis racket anymore. And so I like fully relate to what you're saying. It's definitely a very big challenge, but you do end up eventually finding things that will still help you kind of escape or cope with the pain. And for me, that was music. So I'm wondering, what did you kind of do to change the way that you would escape or help yourself find new hobbies? How did you go about that new route?
Yeah, that's a good question. So I did try out some other sports. Like I tried some cycling for a bit and swimming, and they were a bit better. But overall, I had to kind of realize that I couldn't base my identity around sports. Like I had to find other things that I was passionate about and that brought me joy. So I'm really into art right now, and that was really like helpful and healing. And being a patient partner is really meaningful as well. Um, and yeah, I did some coaching of speed skating for a bit, but then it was like challenging mentally, but physically as well because yeah, it was really cold. You're on your feet, and I just yeah couldn't manage it anymore.
On top of living with fibromyalgia, you also are diagnosed with POTS. Would you be able to explain what POTS is?
Yeah, so POTS is a form of dysautonomia, which means that it's a problem with your autonomic nervous system, which is just a branch of your nervous system. And so for me, it presents as causing like a really, really fast heartbeat, which is really uncomfortable. And so that's called tachycardia. And then it can cause like shortness of breath, chest pain, really intense fatigue. I was reading something the other day that said the functional impairment from POTS is similar to like congestive heart failure because it's just like so tiring to always be working that hard. And then the other big thing with it is that it causes dizziness because your blood pools in your legs. And then that's kind of what causes your heart to beat a lot faster because it's trying to pump it back up. So it can cause dizziness and then feeling like you're going to faint and sometimes fainting.
And what does the medication look like for POTS and your fibromyalgia?
Yeah, so for fibromyalgia, there's not that many medications. So I've tried all of them now, I think. But right now I take Celebrex, which is an anti-inflammatory that some people with arthritis use as well. And that's really helpful. And then I take duloxetine and nortriptyline. And those have kind of been a good mix for me. I tried other ones as well, but got some pretty big side effects. And then for POTS, people take different things. There's a bunch of different classes, but I take a beta blocker, which slows down my heart rate, and that makes me a lot more comfortable.
And so you've been able to figure out what works well for you and like how to manage it. I'm wondering if you use any self-care tips or any pain management strategies that you use to, live your daily life on top of medications.
Definitely. Yeah, that's really important lifestyle factors for both POTS and fibromyalgia, and I'm sure other rheumatic diseases as well, in addition to fibromyalgia. But it's important for me to get like a really good balance of rest and movement. If I kind of steer too far one way, then I'll be in a lot of pain. So that's been really helpful for me to figure out. And then I really have to drink a lot of water and eat a lot of salt for POTS, and that helps with like the blood pooling. So I have to drink a lot of water and a lot of salt, like a lot. So that's a big one as well. And then I really like having heat on my joints. That's also tricky though, because like baths feel so good on my muscles and my joints because of fibro, but they really trigger my POTS. So like, for example, last week I came home from like working at a clinic and was in a lot of pain. Was like, okay, I'll have a bath. But then it was like just a little bit too hot. And so I ended up like really tachycardic, like passing out, like could have gone to the ER for like some fluids, but all because I had a bath to help my pain. So it's like kind of tricky to find a balance between managing fibro and POTS. But yeah, I also have like some braces that help with my joints. And yeah, I have a heated blanket, which is pretty good.
Yeah, I've heard a lot about heated blankets. A lot of people really like them. I've never used one, but
I would
it's
highly recommend it. It's one of my favorite things that I own, especially for anyone who has temperature sensitivity as well. Like when I get cold, like my bones get cold, like I feel like I can't get warm. So the heated blanket and like a bath are like the only things that can warm me up and make me feel better. So highly recommended.
And we talked a little bit about the whole mental health aspect that comes with living with a chronic illness and multiple chronic illnesses. So, how did you make sure that you actually prioritize your mental health throughout your diagnosis journey and to this day?
Yeah, that's a really important aspect of living with a chronic illness. I think that it's not very like typical for a young person to get like a life altering diagnosis, and so that really did weigh on me, and I developed some significant mental health challenges that I kind of brushed away at first because I wanted to like be strong and be a really good patient and like show that I wasn't struggling, but really I was, and eventually that caught up with me, and I had some really significant issues with my mental health and had to go through some pretty intensive treatment. And out of that, I realized that maintaining good mental health is really important for both my physical health and my mental health. Having good coping strategies, being able to like process any kind of trauma that my medical issues brought on, it's really important. And I think that anyone who has a chronic illness that's maybe struggling with it even a little bit mentally would definitely benefit from therapy because it's really important.
And I think there's always a lot of stigma towards therapy as well. I've had a lot of guests on the podcast kind of talk about their experience with it, and it's only been a good, positive kind of experience. And sometimes it doesn't really work out for some people, but I don't think there's like any harm in trying it.
Yeah, definitely. And there's so many different kinds, and there's like a bunch of different areas that people specialize in. Sometimes you click with one therapist and not with another. And so I would definitely encourage people to try it out. And if you can find one that specializes in like chronic illness or disability, I'm sure that would be extra helpful as well, because it kind of brings this whole other aspect. Like have done some group therapy as well, which was really helpful. But I was like the only person who was like disabled or had chronic illness, so that was kind of like not relatable to other people. But then similarly, like if you can find support groups for people with different chronic illnesses, like I think you have like a chat room. Like,
Yeah.
yeah. So things like that are so helpful, and I've definitely done those as well.
You kind of brought the topic up, and I think I'll just continue from that. When did you start identifying yourself as disabled?
Yeah, that's been a more recent thing. I would say within maybe the last year or two. And honestly, it's been a journey in itself to like accept that I even have a chronic illness. And so once I was accepting that, I think I just Googled like, is fibromyalgia a disability? Is POTS a disability? And Google's like, yes. And I was thinking about it, and I was like, you know, that totally makes sense. That fits for me. The way that I can interact with the world is not the same as other people, and I need help to do things that other people don't need help with. I'm in pain all the time. I'm often dizzy. Like that is a disability. And so I kind of accepted that myself and then started introducing it into my language, and find that it does help with like identifying with it.
So I'm wondering if you had any experiences. Do you use like a wheelchair or a cane or, a disability placard when you park a car? How has that been going for you if you use any kind of tools that help you on a day-to-day basis?
Yeah, that's a good question. I don't use any of those things. Definitely in the process of like considering if I should use a mobility aid anytime. But that brings up a whole other issue of scariness. But yeah, I have like some braces that I mentioned, and sometimes people see those and ask like, oh my God, what happened? And then
Yeah.
yeah, there's always the like having to come up with a quick explanation like, oh, I just have a chronic illness and it's flaring up. And then if it's a good friend of yours and they don't know that, they're like, oh, okay. And yeah, it's like surprising for them. But yeah, I think that I kind of just like slowly bring it up sometimes.
Yeah, and the thing is, the more visible it gets, the more questions they ask. And I've had that sort of situation. Like I wear wrist brace or compression gloves, and sometimes people are like, "What is that? Like, did you like break your arm or your wrist or something?" And in that sense, I'm like, no, like I'm just like I'm in a lot of pain today, and I just wear it. Sometimes I don't really tend to tell people, "Oh, I have arthritis," and give them the whole story, but I do find that if they see it more visibly, there are questions that come with it. And sometimes it's like, do I want to deal with this? There's, like you mentioned, shorter ways of answering those questions or keeping it kind of brief.
And like you said, it's always harder when it's invisible and it can come as more of a shock. But then again, it can be helpful if you have anything that makes it a little more visible for people to understand better. So yeah, there's pros
Yeah.
and cons.
It's super tricky. It definitely is. And we talked a little bit about how therapy is very important, but sometimes therapy doesn't work for certain people. So looking for a support group or just connecting with other people your age, living with the same sort of illnesses as you. And I'm wondering what your support group or chronic illness support journey was like.
Yeah, it was like nothing until I was probably 20. I didn't know anyone else who was dealing with anything similar to me. And then I started working at Brigadian Village, which is a camp in Nova Scotia for kids with different chronic illnesses. And during our staff training, my now best friend who has JIA, she shared a little bit about her journey. And I was kind of like baffled by how much I related to it. And then I connected with her, and we had a lot of chats about our experiences in the medical system, like as teenagers, and what it was like. And that kind of started off me like recognizing that I did have a chronic illness and that it's really helpful to connect with other people who do. And so, yeah, I now know a couple other people who have even the same condition as me, and that's just so amazing to be able to have people you don't have to educate on what it's like for you in your day-to-day life. And yeah, as I mentioned, my best friend, she has JIA, and we like lived together and we traveled this summer together. And it's just, yeah, it's really nice to have someone who's always on the same page, gets it, is not going to make you do like really big hikes, and just, yeah, just understands you on a deeper level.
Wow. Who's your best friend? Like,
So her name is Sarah. She's also a medical student. She goes to Queen's.
oh, that's so interesting that you're both like medical students and you both live with. Wow. Very, very cool. Yeah, I mean, that's so amazing that you're able to find like a very close friend who is also on the same career path as you, but also lives with very similar lived experiences. And I think that kind of helps in terms of you're like you said, she's not going to make you go on like a very long hike or walk when she knows you're not okay because she's probably not okay either.
Yeah, exactly. Yeah, we had many times this summer when we were traveling where we would both be like, "Yep, today is not an active day. We're just staying in today." And a lot of people when they're traveling wouldn't do that, so we would just like chill and yeah, deal with our pain together, and it's the best.
You are a medical student, which is super, super cool. What led you to your journey that you are taking right now in terms of education and what you want to do in the future?
Yeah, so it definitely was influenced by my health. But I actually decided I wanted to be a doctor when I was even younger than before my like health issues started. I just was like, hey, I really like science. I really like being able to help people. And then when I started to have my own really significant interactions with the healthcare system, and like bouncing around from a bunch of different specialists and just really seeing how it worked, that really kind of deepened my interest to be a physician and work in that environment and be able to help patients who were struggling. And now I'm just even more excited than ever to become a physician because I understand what it's like to be a patient. And I think there's so many things that doctors will never understand unless they themselves grew up or at least now have a chronic illness. And so I'm super excited to be able to bring that perspective to my practice as a doctor. And yeah, it's nice that it's finally happening because it's a long road.
Did you have any sort of challenges in medical school? Have you had any accommodations relating to your chronic illness?
Definitely. I find it's honestly really challenging. Um, some people say that like managing chronic illnesses is like a full-time job, and I do relate to that. It takes up a lot of time and a lot of energy, but then you could say the same thing about med school. You always hear people talk about how busy it is, how draining it is, how tired they are, and so kind of melding those two things together that are both so taxing is really hard. And there's other like specific challenges, like for example, our tutorial rooms are on a second floor and there's no elevator unless you go on like a really long walk. And so that's something that I've been trying to figure out. And then, yeah, just like there's not really flexibility in terms of when you can go to class. They're all like, you have to go when they're scheduled. And clinic, we started like in placements right away, and it's really challenging to be on my feet and walking around a lot. And some of the skills are harder because of like pain in my hands or like a hand tremor that I have from POTS. And so it's just, yeah, it's challenging. And I do have accommodations. So right now, because we're in like our pre-clerkship years, which means that it's mostly class-based, my accommodations are around that. So for exams, I have extra time so that I can get up and walk around, which helps with both my pain and like dizziness. So that's been really good. And I think I could have access to a note taker if I needed it. So there are those things in place. And then once I get to third year, I'll need some other accommodations because that's when we start like in the hospital for the majority of the time. And so things like night shifts and long hours in clinic, like that might be not very good for my body. So I'll have to deal with that as it comes.
When we have more people with chronic conditions being physicians, then I think that we have more of a perspective to talk more about the accommodations that are important and in place. You know, you are treating people with these conditions. And so I think it's also important to be mindful of like, if the person has a condition. I worked in a lab over the summer, and it's interesting because we do research on JIA, and it was interesting because I couldn't like pipette because of the repetitive motion, and they found it kind of like a learning process for them. And they learned so much from someone who actually lives with JIA. You do research on JIA, but you don't realize that someone with JIA can actually not do some of those things. And so trying to find adaptive ways to work in the lab or like accessible things. I spent a lot of the time moving to the dry lab or like having more of an ergonomic chair because, you know, in the wet lab, the chemicals will spill and you can't have like an ergonomic chair. It's very hard to get one. The more experiences you have, it sounds like you kind of get better at it, and you kind of get better at advocating for yourself and figuring out what works for you.
Totally. Yeah. And I was super excited to hear that you wanted to go to med school because I think it's so important to have like physicians with chronic illnesses and disabilities and like sharing about it, because if you don't see that, then you might think it's not possible. And so it's really, really important to have people like you in healthcare. So I'm excited for you.
Thank you. The whole purpose of this podcast is to bring people on like yourself to talk about things like this. It's possible. And so showing that, you know, even despite you having that chronic illness, you're still being able to like achieve your goals and your dreams, and you're working your way around that, and you're providing tips to people who are listening about how they can go about it. Maybe some of these accommodations may apply to them. I recently talked to a fellow at Sick Kids who lives with JIA on the podcast, and she mentioned some of the things that she considered before she applied to like residency programs or fellowship programs. And so it's just interesting because she considered a lot of things that I should be considering as well, but I would not have thought about it till I got there. So it's like I'm indirectly also learning.
Yeah, I also listened to that episode and I loved it. It was very cool to hear about someone else who lives with a rheumatic disease, like wanting to go into rheumatology.
Let's kind of move on to your interests and initiatives. I know you mentioned throughout the episode that you do work as a patient partner, and I do as well. So maybe we could start off by talking about what is a patient partner.
Totally. Yeah. So from my experience as a patient partner, you are basically like a representative of the patient voice on research projects so that you can help inform the research to make sure that it's really in line with patient needs and values, and that it's going to be like important to patients. You might talk about like knowledge translation. So like how you're going to sort of translate the research from science talk to being actually applicable and accessible to patients. And so, yeah, that's kind of what a patient partner has been for me.
And so you are a patient partner in multiple studies relating to chronic pain and chronic illness in youth. So when did you actually start getting involved in research as a patient partner?
Yeah, I think it was during my undergrad. I heard about this study that was happening on improving transition outcomes in terms of transitioning from pediatric to adult care. And because I had had a rough time with that, I thought it would be really meaningful to get involved with that. So that's where I started. And then I kind of really enjoyed that. And my friend Sarah joined the project with me, which was extra fun. And so then I just kind of started looking for other patient partner opportunities, and I really enjoyed being able to share my experiences for like really impactful health research, and kind of bringing some meaning to some of my more challenging experiences. And so I've, yeah, helped out on a couple of other chronic pain studies. I helped out on one related to mental health in the Maritimes, and I'm always looking for new opportunities to be able to help out with research in that capacity.
I started doing that as well, and I find that it's very empowering and very cool to see that researchers actually prioritize the patient voice. A lot of the times as patients, we don't think that, or like it's just too good to be true, if that makes sense. Like, cause I'm kind of like, no way, are you actually gonna listen to me? Cause I feel like a lot of times as patients, we have our expertise, but obviously we believe that doctors have more expertise or researchers have expertise, but everyone's expertise is very unique and their perspective is very unique. So realizing that, when to get involved in research, your voice is still prioritized and they actually take into consideration what you say.
Yeah, exactly. It's definitely, I like that you said empowering, because it is, because like things that we say as patient partners, they really take it into account and change the research to be more patient aligned. So yeah, I totally agree that it's really meaningful.
Would you be able to talk about one of your experiences in a certain study as a patient partner and what were your roles and responsibilities for a specific one?
Yeah, for sure. So the transition project that I mentioned, that's still ongoing. It's a pretty big study. So that's been the one that I've been most involved in. And so we, as patient partners, there was two of us, me and Sarah, and we would attend meetings. And so we were involved right from the start. So involved in like the objectives, so like what the research was aiming to do. And we helped with language. So for example, they were going to look at like successful transition or non-successful transition, and we thought that that might be a little bit like stigmatizing or hurtful to patients who would meet that criteria for an unsuccessful transition to be labeled as unsuccessful. So we changed it to like secure attachment. So it was, yeah, really meaningful that they took into account our perspectives there. And then they're just finishing up data analysis, and like you don't have to do that as a patient partner unless you want to, because it's definitely not for everyone. And then once the results are out, we'll help sort of figure out how they're going to share the results from the study for both like academic audiences and for patients and families.
It's interesting that you bring up the variety of different tasks or what you can get involved in. I know that in some research projects, like one that I got involved in called the Youth Engagement and Research Study at CanChild and McMaster, they basically kind of allowed us to pick what we wanted to do. So they made a chart and you would have one-on-one meetings with the research coordinator, and she'd have like, okay, in this stage of the study, do you want to get involved in this, or this? And like, they're super nice and very accommodating and flexible. So you could actually pick what you wanted to do at each stage. So if your semester was busier at a certain point, then you didn't have to do that much. And so it was all the way from like, just giving your perspective or reviewing things to actually making content and knowledge translation to data analysis. So there's like so many different things that you can do. And I found that I was able to also learn a lot about research that like I would not have learned about if I wasn't involved as a patient partner. And obviously as like medical students and as you continue like your medical school journey, you're definitely getting involved in other parts of research, not only patient partner work. So have you had any experience of not being a patient partner, being a summer research student or a research assistant?
I did my master's, and that was around health research as well. And so that was kind of interesting because I was working as like a researcher at the same time that I was working on other projects as a patient partner. But I found that was helpful. My patient partner worked for my research as well because, yeah, you're right. Like I learned things as a patient partner that I wouldn't have known. So that was helpful for my master's research, and it showed me the importance of involving patient partners in that research as well. So yeah, it was definitely cool to be on kind of both sides of it.
Yeah, I've had that similar experience too. Like I did a course at U Calgary where I was like a patient researcher. So not only was I a patient partner, but I also was a researcher. So I was all the way from like data analysis to like making the codes. And then we had like a publication out and we all were part of it and we're all patients that wrote the publication. So it was like interesting that the different projects you like get involved in, they're all very unique experiences and they all like teach you something that you could always apply. Because what I learned from one thing, I'm now able to like use that for the next project and be like, yeah, this went really well with this project. I think we should try this. And I feel like you probably have very similar experiences where that has happened.
Yeah, definitely. Yeah, that's really cool that they had you involved as patient researchers. I feel like that's a really important initiative.
I learned so much in terms of qualitative research. Like I would have never learned that as a patient.
Yeah, that's really interesting.
You used to work at Brigadoon Village, a camp in Nova Scotia, which we kind of touched upon at the beginning of the episode. Can you talk about your experience here and what the purpose of this camp is?
Yes, of course. Always happy to talk about Brigadoon. So it's this amazing camp in Nova Scotia for kids with different chronic conditions and other life challenges. So every week there's a different condition. So like for example, there's one week where kids come with juvenile arthritis and it's called Joined Together. So there's cute names for each camp. And yeah, I got involved with that camp a few years ago and worked there in person for a year. And then it was the pandemic, so helped out online. And it was just really meaningful to be able to connect with and kind of be a role model for other young kids who had chronic conditions and help them with any challenges that they were having and chat about transition and what's like to be a teenager with chronic illness. And basically it's just a regular summer camp, but there's accommodations and like medical stuff in place so that the kids will be safe and can do whatever they can, and it's okay whatever you can't do or don't feel up for doing. And so they get to do everything like swimming and crafts and cooking and outdoor games and stuff. And the purpose is just to make kids with chronic illnesses like feel like a normal kid for a week and be able to connect with other kids who are going through this really rare experience. And it's really, really impactful. Some kids, like, you get to witness them opening up about their diagnosis for the very first time, and like the surprise and happiness that comes on their face when they realize everyone else there has the same thing as them. They don't have to explain it. And so yeah, and then since then I haven't been able to work like full summers there, but have kept volunteering for the arthritis week. And then last summer I also volunteered at a different camp that was also running an arthritis society camp in Alberta. So they have these arthritis society camps all over Canada that are just amazing. You get to meet so many other people with similar or same diagnosis.
I've never been to an arthritis camp, but a lot of people that I've talked to, whether that be on the podcast or just people on social media, they've really enjoyed arthritis camp or any sort of camp where they could talk to other people about their chronic illnesses. So I definitely say like check it out if you can. And you can also volunteer if you're like above the age of like participating. I know that a lot of people have now decided to like go from like a camper to a volunteer or like work there. And so I think that there's always still like opportunities to get involved.
Definitely. Yeah. Would definitely recommend if you can be a camper or a counselor. It's both is really meaningful.
I usually like to end off the podcast episode with an advice segment. So what advice would you give to youth who with a chronic illness who want to enter the medical or healthcare field?
Yeah, that's a good one. I would say that just like believe that you can do it because you can, but know what you might need. So it's been important for me to figure out, and I'm still figuring out, what kind of accommodations I need or how to speak up for myself. So I would recommend that you really get a good understanding of your illness, how it impacts you, and how it can also make you a better doctor. And then kind of put those things together. It can help fuel your passion. And So just practice advocating for what you need and maybe connect with other people who are pursuing medicine or who are physicians who also have chronic illnesses or disabilities, because having that mentorship is really meaningful. And just don't be afraid. You can do it. There's challenges for sure, but like it's all part of equity. Like you can get accommodations if you need it. You can get your needs met, sometimes just in different ways. And I'm sure it will be worth it because we need more doctors with chronic conditions.
Thank you so much, Cassidy, for joining me on today's podcast episode. We talked about your symptoms all the way from the age of 14 to when you started experiencing pain from skating. And then we talked about your hip surgery and how, your chronic illnesses impacted you physically and also mentally. We talked about therapy, and you discussed your passion about skating and how difficult it was to stop participating in your favorite sport. We dived a bit into your experience from transitioning care, and then we talked about, the importance of finding support in the rheumatic disease community and the chronic illness community. And last but not least, we discussed your patient partner work and your continued work at Brigadoon Village, as well as the journey as a medical student living with a chronic illness. So everyone, like, comment, subscribe, check out Cassidy's social media channels, which I will link down below, and I'll see everyone in 2 weeks on Take a Pain Check. Thank you so much, Cassidy. Bye.
Thanks so much, Natasha. Bye.
I can't hide, 'cause growing pains are keeping me up.